Hello and welcome. This lesson goes over the role of AI in interoperability as well as other related topics. By the end of this lesson, learners should be able to understand the role of AI in interoperability, understand why AI must be paired with interoperability, understand how AI can help in achieving interoperability among health facilities. There are two basic components of true interoperability. The first is concerned with two or more systems that could be interacting with each other for exchanging information. The second, on the other hand, is about the collected information would then be used effectively to serve its purpose. With the growth in technology, there was noticeable efficiency in the way physicians managed the health records of their patients in electronic health records, EHRs. However, with big data, EHRs began to face challenges. The great promise of EHRs to promote better coordinated care to patients came to be affected. Digitization was one reason for this. Earlier, physicians had to spend a huge chunk of their time managing the paperwork of their patients or decoding the information recorded by previous physicians. This was majorly where EHRs helped, including looking out for transactions where diagnosis, treatments, hospital visits, physician notes, and other details are noted. This was all accessible to patients as well, so they have access to accurate data whenever they need it. However, this is not so good at all times, because there are limitations in EHRs that need to be addressed. The security of data that's shared across different platforms is a serious concern. Details of the patient's information like bodily function, substance abuse, or psychological problems, if any, are some information that shouldn't be shared freely, and lack of security measures could force them upon the wrong hands. In fact, hackers make use of all this medical information for their own purposes. Countries across the world are digitizing health records by setting up an integrated health information platform or IHIP. Ensure there would be interoperability among all the health records and multiple healthcare systems. AI plays an integral role in healthcare data interoperability. Much of the data within healthcare is incomplete or unstructured, coming from various sources via the EHR, PMS/HIS, and other technologies. While it may be impossible for a human or even a large group of humans to process this data, this is achievable by AI. Interoperability has now been effectively paired with artificial intelligence. Artificial intelligence or AI so far played a very crucial role by offering analytical insights into huge powerhouses of data, giving healthcare professionals more power than ever before, including access to potentially life-saving information without losing time. An individual may have hundreds of thousands of healthcare data points, and all this data will have to be collected and used appropriately through machine learning. This is where AI works with interoperability. Why interoperability is difficult to achieve between EMRs, health facilities? The best way to harness the total potential of health facilities, such as EHR, is through interoperability. It helps healthcare providers provide better coordinated care at lower costs, but data is easily accessible to different physicians in a safe manner. However, it is not easy to achieve interoperability among the different devices, because there is a large number of fragmentation among the different vendors. The large companies integrated with EHR systems cater to the interests of specialized providers. Some cater to the demands of large hospitals, while some serve the needs of smaller physician practices. The challenges could be pertinent while sharing patient records and patient information across organizations, between providers who are geographically dispersed, between different EMR vendors, and even among vendors using different instances of the same EHR or in competition with each other. Here are some commonly faced challenges in the usage of EHR. Inability to share information across systems. There is a lack of secure, compliant, and private communication system that allows individuals to share medical information, but at the same time support enterprise needs. Issues in getting 100% interoperability while sharing electronic records. achieving 100% interoperability when physicians share their patient records with other providers irrespective of the software they use is so challenging. Providers get competitive or are geographically dispersed. One of the main reasons why the data is not getting shared properly is the competitive spirit of the vendors in a negative way. They don't like to give out user security and permission, and they try to limit the data sharing so the patient information remains in their system. High technology costs. There was a huge spike in technology costs, perhaps due to the high demand in physician-owned multi-specialty practices. Why interoperability should be paired with AI. EHR developers use artificial intelligence to perfect the digitization of medical records. Intuitive interfaces, voice recognition, dictation, and automating routine processes are some of the perks associated with it. Just like we are used to Siri and Alexa at home, virtual assistants will also soon make their way to the patient's bedside to provide clinical assistance using embedded intelligence. AI can also use routine requests from the inbox and even prioritize tasks like a clinician does. These are exactly the reasons why you need interoperability. Processing big data, precision medicine, and all other advantages that come with AI can be optimally used only when interoperability is there. The competition is also mostly about delivering care that's precise, accurate, and timely. Apple is a great example of this scenario. The company is making huge waves in clinical studies, using data with ResearchKit, medical research collected data from every source, and CareKit, where patients can manage their own medical conditions. CareKit can be integrated with hospital medical records, have an activity scorecard, symptom checker, and monitor the progress of a patient. Since data is the main thing in AI applications, it can even provide medical researchers with information that was not easily available. How AI can help achieve interoperability between EHRs. AI capabilities for EHR systems are continually being explored, and the integrated delivery networks using the technology with EHR help to make it more flexible and intelligent. Through interoperability, AI makes the EHR to be more user-friendly, apart from providing personalized care options and gleanable insights through data discovery and extraction. AI can collect both structured and unstructured data silos in the healthcare industry through interoperability. Achieving interoperability is very important since it would enable improved access to records and pertinent health information. Here are some ways in which AI works with EHR systems to make them flexible and accessible to healthcare professionals and to patients. 1. Extracting tons of data from faxes, clinical notes. Procuring data from clinical notes and faxes can be a hard task. But now you have service providers that can help you collect the data and gain meaningful insights from the same. For example, Amazon Web Services has a cloud-based service that helps you collect and index data from clinical notes. 2. Algorithms that aid in timely diagnosis. It would be greatly helpful to patients if clinicians can detect diseases and certain conditions before they actually occur, for example, heart failure. AI collected from various sources can identify patients with serious medical conditions and how they would respond to it. This would then be fed into the EHR system to help with treatment strategies. 3. Documenting clinical reports accurately. Clinicians might prefer to be spared the mundane details of worrying about their screens and keyboards. Through natural language processing, it is possible to capture clinical notes to help with data collection and preparing reports. For example, Nuance is a healthcare solutions company that integrates EHRs with AI-supported tools for this purpose. 4. Top-level accuracy in clinical decisions. Earlier clinical decisions were more generic and based on rules. But machines have become smarter, and by using this kind of artificial intelligence, it is possible to offer higher levels of personalized care. IBM Watson, Change Healthcare, and Allscripts are examples of such services. Interoperability between and across different platforms also helps intelligent algorithms formulate a shared understanding and helps make other AI and ML models across vendors more flexible. This approach helps accelerate innovation and helps advance the AI field. This concludes the lesson on AI and interoperability. Thank you for watching.